My name is Cheryl. I am a person who has lived with substance use disorder and mental health issues as well. But the topic today is definitely about recovery and addiction. So I'll share a little bit with you about my journey. For me, my addiction started when I was a youth. I experimented as an adolescent, and I found that alcohol and drugs did something for me that resolved some of the pain that I was experiencing as youth growing up, which many of us do. But for me, it crossed the line. I started using a lot of drugs, using them daily. By the time I was in senior in high school, I almost dropped out because I was just using so much and wasn't able to function. So my venture into recovery started with the treatment program that I went into, an inpatient detox, and actually it was a 30-day program, and they taught us a lot about recovery and peer support, and I was able to be around other people who were like me, who had experienced exactly the same pathway with addiction, and learned how it just wreaked havoc on my life mentally, emotionally, spiritually, and physically. And I learned how others were moving forward without using drugs and alcohol by being around in that environment, I guess that culture of peer support, which we know formally as 12-step programs, early on in the way people were getting support for their addiction once they left treatment. And so many people have utilized the 12-step programs to maintain their recovery. And it's something that was very important to me. So that's a little bit about my journey. I have been sober many, many years, off and on. For the most part, now I'm 14 years clean, coming up on 15 in January. It's a very exciting time. It hasn't been easy. I have had some relapses over the years trying to get myself together, and but I was always able to reach out for support. One thing that I learned in my journey was about peer recovery specialists. I became a peer recovery support specialist when I was working in an agency, a community mental health agency, where peer support was being utilized in a way that was a little different than I was exposed to in the 12-step community. They were actually employing peers to use their lived experience to help others, because we know the value of the impact. So in Virginia and in many other states around the country, there's actually a profession that is coming around, that is evolving, and we actually have a Virginia Certified Peer Recovery Specialist certification that people can pursue in Virginia through the Virginia Certification Board. And with that training, folks are able to utilize their lived experience to help others. So over the years, I've been exposed to many different types of training in how to use my lived experience, and how to overcome my own challenges, and then be able to help other people with my coping skills and hope for themselves to get better. I can work with others, live with lived experience with addiction, again, by sharing my experience, strength, and hope. I always ended up in a very bad place, as you do with addiction or a lot of other mental health disorders. But the thing that I gravitated towards alongside of my formalized treatment was to be around other people like me. And that's where I didn't feel so isolated and alone. There's so much stigma with these, living with these disorders like addiction and mental health issues, that it feels very isolating and alone. And when I'm stuck in my head with my own thoughts, then that's not healthy either. So there's a lot of tools and resources that I can share to help other people, how to connect spiritually, how to reconcile with family issues, how did I overcome that? How did I deal with that in my employment, in my workforce? And definitely something that you guys are talking about today. Yeah, I think with peer support, we can definitely use this model of care within the traditional workplace by offering opportunities for people to connect with others who have been through the similar situations. It's the community in recovery, mental health and substance use recovery is very strong. It's out there. It's just really connecting people to those resources. When you're talking about an environment like Norfolk Naval Shipyard, or say, working in an office space or anywhere, it's really just about being able to connect people with other people who have been there. And if you can set up opportunities for that peer support to exist, then it's really going to make an impact. So that things can be done perhaps through kind of informal, by posting up flyers or putting out information to employees that there is a support network that exists when people are dealing with these types of issues. And just making sure that they're aware of those resources, and then give them the opportunity to connect with them. And if that's something that might happen in a lunchroom, on a lunch break, before work or after work, there's things, that little catchwords that we know that we can stay anonymous without even self-disclosing, but still meeting with people who are like us by using catchphrases like Friends of Bill W. That's one that you might hear about. So if there's Friends of Bill W. are meeting after work, and there's an opportunity for people to gather, then, if you put those supports in place, and people are likely to show up. So, think along that line. How can we, or how can you support people who struggle with addiction or anything else that might be giving them a hard time in their life? You think about people who live with diabetes, or in going through some type of bereavement or loss of a loved one, or caring for a loved one who has cancer or any other chronic disorder. We need to support those people just like we support people with addiction. It goes the same way. So if you know somebody who is struggling, reach out. Hey, I hope you feel better. Let me know what I can do to help you. And make those opportunities available in the workspace, in communities, and let people know.